Do you want to refer to it? Or?
We're doing cervical range of motion, active and resisted. So we start off doing the cervical range of motion in a seated position. We have a lot better visual perspective when we've got them seated and they're not standing up high. And it also gives us a better position to do the resisted movements in. So we get them seated and we stand and watch from behind is the best place to do, because we're watching and we can also palpate at the same time. As they're moving their neck and their head, we can feel what's happening in the tissues under our hands. So to do an active range of motion, I have to give very clear instructions about how to, for my client to be able to do those. And the first instruction that I'm going to give is for Hannah to tilt her head down towards, her chin down towards her chest. And when I've got my hands on the back here, I can feel the tension in that tissue coming through the upper traps and the levator scap. And I can see that there's some restriction there in the suboccipitals and the posterior cervical muscles just coming back up. And then I give little tappy cues as well. So when we're getting our clients to go from left to right, some of us are left to right dyslexic, so we can give little tappy cues to say, I want you to tilt your ear down towards your shoulder. And then we're having a look at how much range she's got there. 45 degrees is pretty normal, and we're feeling and also observing what's happening on the other side. Is this restricting any of that movement? Just coming back to the centre, and then we're going to do ear to shoulder on this side, and same thing. So feeling what's going on here, observing the tissues, the scalenes, and the upper traps on this side, and just back to the centre. And I'm going to get you to look over your left shoulder. Okay, and back to the centre, and over to the right shoulder. So 80 degrees is pretty normal for range of motion over in rotation, and Hannah is fairly normal there. And we're going to get you to do extension, so chin to ceiling. And it's just that nodding movement. It's not going back into hyperextension, because that's really bad for the structures of the cervical vertebra. So we're just doing that chin to ceiling movement and stopping them there. Passive movements we're not going to do. You can do your passive movements as part of your treatment. I'm going to move straight into resisted movements. So the hand positioning for resisted movements for the cervicals is just under the occiput and on the forehead for flexion. So Hannah, if you can just do that same chin to chest movement. And I'm asking for about 10% of her effort. Okay, and I'm just matching that 10% with the resistance. Going back to the centre and then just going to the ceiling. Also 10% of her effort there. Back to the centre. Hand positions for lateral flexion and rotation is just above the ears. So I'll get you to do ear to shoulder to the left. Tappy movements there. Okay, back to the centre and to the other side. Back to the centre and then rotating around to look over your shoulder. Back to the centre and then to the right. So I just take her into a little bit of the movement before going into it, so that she knows which direction she's going into, and the contraction is just enough to initiate. That 10% is just enough to initiate a contraction. You're not fighting against each other by doing massive 100% strength tests. So that's cervical range of motion, active and resisted.